be providing guidance about how to keep your home safe, how to keep your business safe, how to keep safe and healthy at your school, and we'll be publishing that information and speaking about that. A brief word about the Grand Princess. The Grand Princess has docked this afternoon in Oakland, California, at a commercial dock. 25 children. We were happy to learn through the screening over the last 2 days. The 25 children on the ship are all healthy. Of the people that have contracted the coronavirus, 21 in all, they are being dealt with in proper isolation, working with health authorities in California. We hope before the end of today to begin to disembark California residents to Travis Air Force Base and Miramar. We've made arrangements with Canada and the UK to take their passengers back. They'll be transported directly to the tarmac, charter flights home. And tomorrow, the remaining passengers will be transported again through very, very carefully controlled environments, buses, out to the tarmac and flown to military bases in Georgia and Texas. All the passengers will be tested, isolated as appropriate, quarantined as appropriate, and I want to express appreciation to the Governor of California and his administration, the Governor of Georgia, the Governor of Texas for their strong cooperation with us in resolving the issues around the Grand Princess. It has been a partnership which the President directed us from the very beginning, and the process that Bob Kadlec will detail in any questions in a few moments continues to work and move forward. The remaining people on the ship, the crew itself, will push off from the dock, and they will be quarantined and observed and treated shipboard. But the President made the priority to get the Americans ashore, and we're in the process of doing that, as well as returning foreign nationals. Let me just say one other point. As the President's spoken today to congressional leadership, one of the things that I informed the President that I've been hearing from governors is the concern about hourly wage earners in this country feeling that they had to go to work even if they were ill. The President has tasked this economic team and is working already with leaders in the Congress to make sure that that anyone feels that they are at risk of losing their job or losing a paycheck because they may contract the coronavirus. When we tell people, if you're sick, stay home, and the President has tasked the team with developing economic policies that will make it very, very clear that we're going to stand by those hardworking Americans, stand by those businesses, large and small, and make it possible for us, as the President said from the very beginning, to put the health of America first. We'll be available to take any questions on any of these topics, but, Mr. President, I didn't know if you wanted to speak a few more.
I think what
closing.
we will be doing is having a news conference tomorrow to talk about various things that we're doing economically. They'll be very major, including, obviously, the payroll tax cut. And so we'll be meeting again tomorrow afternoon. We'll be coming back from the Senate. We have a lot of very important meetings set up. And we'll have a press conference sometime after that, and we'll explain what we're doing on an economic standpoint and from an economic standpoint. But they will be very, very dramatic. And we have a great economy. We have a very strong economy. But this blindsided the world. And I think we've handled it very, very well. I think they've done a great job. The people behind me have done a great job. So I will be here tomorrow afternoon to let you know about some of the economic steps we're taking, which will be major. Thank you very much.
Have you been tested?
Thank you, Mr. President.
Has he been tested? Have you been tested?
I have not been tested for the coronavirus.
Has the president been tested?
He's been in contact with people who were in proximity to somebody who had the virus.
Let me be sure and get you an answer to that. I honestly don't know the answer to the question, but we'll refer that question, and we will get you an answer from the White House physician very quickly. Let me ask Dr. Fauci and Dr. Birx to come to the podium. You all and the American public will have at their fingertips very quickly guidance that this is for every American. We're working with communities like the Seattle area, like portions of California, New York, and Florida that have what we call community spread, a concentration of coronavirus cases. But we directed our team to come up with helpful recommendations for every American family, every American business and school. And if Dr. Birx and Dr. Fauci step forward, they can outline that for you.
Great, thank you. Good evening. It was good getting out last week, meeting with communities. We know that the real solutions to this is every American has a role in stopping the spread of the virus. And so we wanted to really put out guidance for every American and every community that was practical and common sense, but detailed in a way that everyone would know precisely what to do. The guidance will be around how to keep workplaces safe, how to keep schools safe, how to keep the home safe, and how to keep commercial businesses safe where people would eat or be present. The importance about this is we believe that communities are at the center of this. I came from a field where it was the communities that really solved our issues around HIV prevention. And so we're very much speaking to the communities and the American people about what can be done. All of this information came from a paper that Dr. Fauci provided from the Australians, first author Dalton. So you can actually look up the scientific evidence that informed each of these guidelines. But we will be providing that this evening in great detail so that every mother, father, child, son, daughter, caregiver will know precisely what to do and what to ask for.
Dr. Fauci?
Yeah. Just to reiterate what Dr. Birx said, it was as simple as that. We have been speaking about the kinds of things that would keep our citizens safe in a variety of environments. We've been speaking about on telephone calls. We've been speaking about at conferences. The CDC has been talking about this for a long time, as has Dr. Birx and I. So we thought we would put it together in a neat formed way that would be available to the general public. What Dr. Birx had mentioned is that just the other day I got one of many, many emails where some of my colleagues that I know from Australia actually decided they were going to write a paper on it and make a number of boxes, which was exactly saying what we had been talking about. So we came up with the idea it would be very good for clarity. So why don't we just put it together, edit it a little, and put it in a way that people can look, what about the home, what about the school, what about the workplace? These are really simple, low-tech things. There's nothing in there that's complicated, but it's just stated in a way that's clear that people can understand.
I might ask the Surgeon General if there's anything about the guidance you want to reflect on.
Well, one thing I want folks to know is that we have been looking at the data from around the world, and we now know more than we ever have about who is at risk. Who is at risk, and I hope you will help us communicate this to the American people, are people over the age of 60. They're much more likely to develop complications from the coronavirus and to be hospitalized from the coronavirus. The average age of death is age 80. Now, what we also want communities to know is that if you are a child or young adult, you're more likely to die from the flu if you get it than you are to die from coronavirus. So there's something about being young that is protective. We want people to be reassured by that. We want people to know that we are really focusing in on those groups that are at highest risk for complications and helping them understand how to be safe. And this new advice that's going to be coming out tomorrow is designed to keep our community safe, to help keep the most vulnerable safe. And it's important to understand that even though young people aren't at risk for dying from coronavirus, they can potentially spread that to older people in the communities and people with chronic diseases. So it's important we all take precautions, washing our hands, covering our cough, keeping our distance from people who are sick, and taking the steps that will be coming out in this new guidance to help make sure we're doing everything we know possible to keep our most vulnerable protected.
Great. Well done. Thank you. And I'm going to I think the Surgeon General raises a very important point. You know, my mother is 88 years young. My stepfather's about the same age. this is just a really good time. What Dr. Fauci tells us, what the experts tell us, is to look after family members, loved ones who are senior citizens, and particularly those who have serious underlying health conditions. All the data, Dr. Birx confirms to us that they're the most vulnerable to serious consequences if they contract the coronavirus. But the guidance that we would ask members of the media and the American public looking on, you can go to coronavirus.gov. This information to be posted tonight, and hopefully it will be useful, helpful, common sense for families, for schools, for businesses, and for commercial establishments that welcome the public in, just to create the kind of practices that we believe will mitigate the spread of the coronavirus across the country as a whole. But with regard to seniors, I might just ask SEEMA VERMA to step up and speak about. Last week at the President's direction, we raised the standards for every nursing home in America with regard to infectious disease, and we are deploying all 8,000 of our inspectors in every state, as we told the governors today, to focus exclusively on infectious disease compliance at our nursing homes. Our hearts break for the families at the Kirkland Nursing Home in Seattle. The loss of life has been grievous, but we are sending the message out, working with our governors to make sure our nursing homes and long-term care facilities have the additional layer of protection against the spread of the coronavirus. And maybe you'd give us
Thank you. Thank you, Mr. Vice President. As he said, that's exactly where our focus is. It's around infection control, and we're working with the entire healthcare industry. Today we issued more guidance to nursing homes about really upping their screening of people that are coming into the nursing home and making sure that, you know, they're gloved and they have masks so that we can protect people that are in the nursing homes. The other thing that we're doing is, because we know that many of our senior citizens are vulnerable, we want to make sure that they know that the Medicare program is behind them, and we're here to support them. We're letting our patients know that they can get a coronavirus test and that there is no cost sharing associated with that for our seniors on the Medicare program. And we're also letting them know that because of the President's leadership, over a year and a half ago, he took action to actually extend more telehealth benefits to our nation's seniors. And this is a very historic change that we made under the President's leadership. And so if they're sick and they're ill, they can call their doctor, they can Skype with their doctor, and Medicare will reimburse for those services. And we've also, in our conversations with governors today, we've talked about having telehealth services also available in the Medicaid program.
Great. Let me invite Bob Kadlec, who is Deputy Secretary of HHS, to come forward as well to fill us in on the latest on the progress on the Grand Princess.
Thank you, Mr. Vice President.
That is dockside now and is going through a very careful process of having Americans and foreign nationals come off, and everyone will be tested.
Thank you very much, sir. And yes, we began our medical operation to basically disembark those passengers. On Saturday, we placed a medical crew on that boat to augment the physicians and nurses that were already on the ship. We basically ensured that the quarantine on the boat and isolation were being enforced, and then evaluated first the children and those who were ill, identifying anyone who is severely ill if possible. When the boat arrived on dockside today, additional medical personnel came on board, and we began an orderly disembarkation. Our intent is to basically disembark about half of the passengers on the boat today and the other half tomorrow. And everyone will be medically screened before they get off. If there's any question about their physical or health, they'll be screened again more additionally. And then they'll be transferred to one of the 4 quarantine sites in the United States: Travis Air Force Base, Miramar Naval Air Station, Lackland Air Force Base, and Dobbins Air Force Base in Georgia. The foreign passengers will be transferred. The Canadians will be taken back to Canada, and we're working with the United Kingdom to return their passengers back to the United Kingdom. But we're doing this all in cooperation with the great support of the state of California, the city of Oakland, and with the support of the Department of Defense, Department of Homeland Security, and the U.S. Coast Guard. Thank you.
Great. And on the subject of testing, we had a very good discussion today, as I mentioned, with 47 governors, and outlined for them all of the different testing methods that are available. We have tests now in every state lab in America, but we're rapidly expanding that. And let me ask the Secretary of HHS to give us the latest on the availability of testing to the American public and to the states.
Great. Thank you, Mr. Vice President. So we continue with our strategic plan at HHS across all of the components represented by many of the leaders here, which is to diagnose, to treat, to contain, to mitigate, to research, and communicate. It's what we do in a healthcare crisis situation. One element of that is the test, which, of course, CDC developed in record time after getting the genetic sequence posted from China. That then was available at CDC, and from that point on, there was no individual that a public health official needed to get tested. The CDC didn't have surplus capacity to test, but we've been moving progressively to bring that test closer and closer and closer to the patient and to the bedside, and to make it as easy as possible for us to use testing, very much in line with our peer countries facing similar epidemiological circumstances. At this point, we, as many of you who were here on Saturday for the briefing know, we have over 1 million tests that have shipped from CDC and 2 private contractors that are the CDC type of test. Those are now out, and as the Vice President mentioned, every state public health lab is validated and operating those tests. In addition, hundreds of thousands of those tests are in hospitals, in private labs, in commercial labs. We now have a total of 2.1 million tests that are available, either shipped or waiting to be shipped or waiting to be ordered. We, by the end of this week, expect to be able to be producing up to 4 million tests per week in the United States. And that is on top of what the private commercial entities, the companies you know of like LabCorp or Quest, using their technology, the tests that they're getting out, which is an even better experience for the patient, because those work, they are able to actually collect samples directly in doctors' offices, have a very sophisticated collection system to their labs, again, making it a very much more seamless patient experience. They're now validated and getting up and running, and that you'll see even more of that. So as I said, over the next week or so, you're just going to see a progressively better patient and physician and provider experience connected to diagnostic testing here in the United States. Thank you.
So how many have been
Very
tested
good.
so far? Do you have that number?
Maybe questions in just a moment. We'll come back. We'll come back. With that, I want to invite the director of CDC to come forward just to give you an overview of where we are in the country with regard to cases, and then we'll take questions on any of the topics.
Thank you, Mr. Vice President. We do continue to see an increased number in cases. Again, as we said we would, as time passes. We currently have over 500 cases now in the United States, outside of the repatriation cases and the cases on the Diamond Princess. We now have cases in 35 states that have been reported in the District of Columbia. I want to reiterate what the Vice President said, despite what I just said here, is that at the present time, the risk to the American public does remain low. We do have several community outbreaks, which we're focusing on in the Seattle area, in the Santa Clara, California area, in Westminster in New York, and in Florida. And these are areas that we're investigating heavily to try to understand the transmission mechanisms there and begin to help these jurisdictions begin to operationalize a series of mitigation strategies to help, again, to slow and contain the outbreak. Thank you.
And let me say, just before we go to questions, coronavirus.gov. For the American public, for healthcare professionals, it is a comprehensive website. We're adding to it every day. And also, Dr. Birx, we're working very diligently to establish a single website where people can go to track all of the cases and where they're emerging. Questions, please.
Could I ask you and Secretary Mnuchin, if I could, the stock
please.
market, a huge slide today, and people on Wall Street now talking about the possibility of recession. Some people saying it's a better than 50-50 chance that will happen. How worried are you that will happen?
Well, let me just first say, today was an unprecedented move in the oil market. So, we saw a overnight reaction of down 20%, and that's obviously obviously what had a major component today on the stock market. But let me just make a couple of comments more broadly about the economy. First of all, we couldn't be more pleased that coming into the situation with the coronavirus, the U.S. has the most resilient economy in the world. You saw a very large economic jobs number last month, and we couldn't be more pleased that the president's economic programs of tax cuts, regulatory relief, and trade have put the economy in a very good position. I would also just say that I am in daily conversations with Chair Powell. We are committed, and we just had a meeting with the president and the economic team. The president is committed that whatever support we need to provide to the U.S. economy, we will use all our tools, working very closely with the regulators. The president has the bank CEOs coming in this week. We'll be talking to them about what they can do to help small businesses and companies that are impacted. So let me just again emphasize our primary focus is there are parts of the economy that are going to be impacted, especially workers that need to be at home, hardworking people who are at home under quarantine or taking care of their family. We'll be working on a program to address that. We will also be working with small businesses who need liquidity through SBA programs. We're looking at alternatives at the IRS. We have large tax payments coming up of providing certain relief to companies and individuals for liquidity. So the president is 100% committed that we will provide whatever tools we need, that the economy will be in very good shape a year from now. This is not like the financial crisis where we don't know the end in sight. This is about providing proper tools and liquidity to get through the next few months.
Follow up?
Well, let me just say there are certain authorities that the president has that we can do on our own, and we've already cataloged those tools. We have a large group, a sub-task force of Treasury and NEC working on this. We are also working with bipartisan leadership on a whole range of alternatives that we'll be discussing with them tomorrow. And as you know, we had bipartisan agreement on the spending deal. We will use the same approach to work with the leadership on the House and the Senate on this.
You just said that you have not been tested. You said you don't know if the president has been tested, but today we learned that the president has interacted with two lawmakers who have interacted with someone who is positive for coronavirus. So why not get tested?
Well, I just simply don't know what the White House physician has recommended to the president, but I promise you we'll get you that information.
When do you think you could let us know if the president has been tested?
We'll let you know tonight. Right away. Yeah, but look, this is obviously the White House physician is their directive is to see to the health and well-being of the President of the United States, and we'll get you a very direct answer on that. I've had no recommendation that I would be tested, and but let me just say to everyone, I really do believe that the guidance that we put out today would be very helpful and very encouraging to Americans. It was fashioned by Dr. Birx, Dr. Fauci, some of the leading experts in infectious disease in the world. And for families that are looking on tonight, to go to coronavirus.gov. You can find information about how you can just make your home safer, your family safer, your school safer, your business safer, and we recommend that to your attention. Yes, please.
Mr. President, do you believe, and does the President believe, that what happened in the stock market today and what we're seeing among American industries, some of which the President named today as being affected and in trouble here, are in any way a result of this White House's reaction to the coronavirus crisis? Is this the markets and American businesses saying that you guys are not enough in charge and didn't think enough ahead?
Well, I have to tell you, I'm about a week and a half into being asked to lead the President's White House Coronavirus Task Force. And the men and women standing behind me and all the men and women standing behind them have done a remarkable job responding to this. The President's decision to suspend all travel from China, Dr. Fauci, I think, reflected just last night on national television about the time that bought us, the decisive action in declaring a public health emergency. I really do believe that the American people can see that This president is putting the health of the American people first. But make no mistake about it, as we go forward, and particularly as we have more testing available, and we have these communities that have community spread, there will be more cases. But we simply ask. We ask today for the American public to join with us in the common sense practices that will mitigate the spread of the coronavirus. And also, particularly, we're asking every American to look after our seniors who have serious underlying health issues. They are clearly the most vulnerable, and that's where the focus of our energy is today, even as we do everything that we can, working with governors at every level, state and local public health officials to limit the spread of the virus.
If I could ask a question of Dr. Fauci. Thank you, Mr. Vice President.
Dr. Fauci.
You're up to it. More and more organizations, charities are canceling fundraising events, other events. Is that prudent? Is that an overreaction? Do you think the president should continue with campaign rallies? And do you believe that people, even if they're healthy, should get on board a cruise ship?
Okay, so there's multiple different questions, John. So the idea about individual entities, governors, mayors, or whatever, canceling activities that are not coming from a direct recommendation from the federal government, I think that they have I know they have the authority to do that, but what they're probably acting on is what they would consider for their citizens an abundance of caution. Most of the time when that happens, it usually is in an area where there is already documented community spread, and Dr. Redfield mentioned the 4 areas right now that are having community spread that's documented. But there may be, as we know, it's a possibility that there's community spread going on in areas in which we're not detecting it yet. And I think that's the response of the individuals, be they mayors or governors who have you, who are doing that. So I wouldn't criticize them for that. They're using their own individual judgment. And to me, I think that would be prudent.
Campaign rallies?
I can't comment on campaign rallies. It really depends. We are having, as we've all said, this is something in motion. This is an evolving thing. So not sure what we're going to be able to say at the time where you have a campaign rally. If you're talking about a campaign rally tomorrow in a place where there is no community spread, I think the judgment to have it might be a good judgment. If you want to talk about large gatherings in a place where you have community spread, I think that's a judgment call, and if someone decides they want to cancel it, I wouldn't publicly criticize them.
Mr. Vice President, I had asked one last one about cruise ships because a lot of people are planning cruises over the spring break. Do you recommend that anybody, even a healthy person, get on board a cruise ship?
I think if you're a healthy young person, that there is no reason, if you want to go on a cruise ship, to go on a cruise ship. Personally, I would never go on a cruise ship because I don't like cruises. But that's another story. But the fact is that if you have the conditions that I've been speaking about over and over again to this group, namely an individual who has an underlying condition, particularly an elderly person that has underlying condition, I would recommend strongly that they do not go on a cruise ship.
And let me also say, John, I think you raise a good point. We're expecting a proposal tomorrow. The DHS, the Coast Guard, all of our health officials are currently discussing with the cruise line industry. I was in Miami on Saturday. We made it very clear that we needed cruise lines to be safer, to establish and to embrace new protocols, screening on board, screening off, new medical protocols, shipboard processes for evacuating people that may contract coronavirus or a serious illness. And I know the president was grateful that our cruise line leadership all stepped up to the table. They said they're ready to go to the next level. And so we'll be reviewing that proposal tomorrow with the objective that apart from the Americans that Dr. Fauci just described, seniors with serious underlying conditions. We're going to work with the cruise line industry to improve the safety, improve the health environment on cruise lines in the short term and in the long term. Yes,
President. Thank you. Sorry, I got it. Last time President Trump was in this room, he told us that the number of U.S. cases was 15 and would soon go down to 0. You guys are saying today that the number is going up and it's more than 500. What is the discrepancy, and how was he so wrong on that number?
Look, I think what the president was referring to is that we will have people that test positive and then they get better. President Trump wants the American people to know, and I'm going to ask Dr. Birx to reflect on this for a moment. The vast majority of people who contract the coronavirus will get better. And the president's just challenged our task force as the numbers grow, and they will. As we'll continue to test more and more Americans. We are, as I'm standing here. That it's also important to remember that people, with the vast majority, get better completely. Some large percentage have mild flu symptoms. Some have serious flu symptoms. But then, of course, for the Americans you heard the Surgeon General refer to, seniors with underlying serious health conditions Dr. Fauci referred to, we're committed to lean in and to make sure they have the support they need. But the president's focus here is just making sure people understand that while the numbers grow, there are people that come off the list because they get better. And Dr. Birx, did you want to reflect on what we know about the cycle of the coronavirus?
Yeah, thank you. So we know the coronavirus reacts a lot like the flu in the way it spreads and in the way we prevent it. And so when we put out the guidelines to the American people, they will reinforce the guidelines, and we hope the number of flu cases go down too, because people will really be what we call situational awareness. I did want to add one piece to our cautions about people with pre-existing conditions. We also know that there are children with pre-existing conditions, and we know that there are individuals that are undergoing chemotherapy for their treatment of cancer. For those individuals, if they have what we call decreased number of white cells, and they will have that discussions with the doctors, they are given often a sheet of paper that really describes how they need to protect themselves and how their family needs to protect them. So I want to make sure that we understand, yes, we're concerned about the elderly, we're concerned about others with pre-existing condition, but we're also concerned about anybody who may be in an what we call an immunodeficiency state, having less white cells and less able to combat any virus. We want to protect all of them from the flu, and we want to protect all of them from coronavirus, and that's why these guidelines are particularly important.
Last question.
It really is important, I think. And I want to ask all of the journalists in the room, do what you can to distribute this information, coronavirus.gov, because exactly the reason that Dr. Birx just said so well, that we want to make sure that families have the tools, businesses have the tools, even in areas where we don't have a significant outbreak of the coronavirus. We want to make sure that the American people have the tools to prevent the spread of the coronavirus, particularly with regard to the most vulnerable.
Yes, Mr. Vice President, earlier you said you'd tell us how many Americans have already been tested. And as a follow-up to a question that was asked earlier, are the president's tweets hurting your efforts at all? Because he's accused the Democrats and some of the members of the press of making more of this than he says it is. He's made lighter of it than you all have here. So has his tweets hurt you? And can you please tell us how many Americans have been tested?
I'm happy to do that. The president's leadership has made the difference here. I heard it again today from 47 governors. Governor Larry Hogan joined me in the Situation Room. He's the chairman of the National Governors Association. I think every American would be inspired if you could see the way, under the president's leadership and in cooperation with governors in every state and every territory, we literally are working seamlessly on behalf of the health of the American people. I'm going to invite the Secretary of HHS to come up and speak about how the number of tests that have been done and where we are. The tests that are available, he's addressed, but in terms of those that have been conducted.
So we've told you we'll tell you what we know and what we don't know. Okay? So there are different types of tests that get sent out. The CDC's test that CDC is sending out, that's that enough to test 75,000 people that was sent out last week. Those go to public health labs, about 80 labs in the United States, one in each state at least. Those report results back in to the CDC because they're part of the public health network. The larger quantity of tests that shipped, about 900,000 of the tests that shipped by this weekend, and then so many of the remainder of that total 2.1 million tests, those go to hospitals, private labs, others for testing. They don't currently have to report to us that they've conducted a test or what the result of that test is. The CDC is actively working right now to build that IT connectivity with them so we can gather that information. So right now, I could not give you a number of how many Americans have received a test because many will have received a test through hospitals or non-public health labs. And so let's work. We're getting the system, the IT system up through CDC. We want to give you accurate information as we go. Dr. Redfield, is that fair?
If I may, everyone, thank you all for being here. We will be back here tomorrow, and we'll continue to bring the latest information forward to the American people. Again, let me encourage all of you here and everyone looking on around the country to go to coronavirus.gov to get really useful, practical, common sense recommendations about how to make your home safer, how to make your school safer, how to make your business and any enterprise out there safer. These are practical recommendations from the best experts in America, and we commend them to your attention. But let me also just have a word of encouragement to everyone. I want to say again, all of our medical experts, apart from the areas where we have community spread and we're focusing resource, the risk of contracting the coronavirus for the average American remains low. It will remain that way more so if all of us continue to practice common sense habits in our home, in our businesses, in our schools, in our public institutions. And so it's important to remember what President Trump said. We're all in this together. It's not just going to be a whole of government approach. It's a whole of America approach, and together we'll get through the coronavirus. Again, details on all the latest information, coronavirus.gov. Thank you.
Hello, everyone. I'm Lana Zach. You've been listening to President Trump, Vice President Pence, and members of the Coronavirus Task Force hold a briefing in the White House. They've been directing people to the coronavirus.gov website for additional information. The administration is trying to reassure Americans as cases grow in the U.S., taking a major toll on Wall Street. Treasury Secretary Steve Mnuchin downplayed fears, pledging that, quote, the economy will be in a very good shape a year from now. The president also said that his team would be looking into small business loans and protections for hourly wage workers. Monday marked the worst day for stocks in the U.S. since the 2008 financial crisis. The Dow fell more than 2,000 points. That's nearly 8%. Collapsing oil prices also strained global markets. Prices sank 25% this weekend amid a lower demand for oil since the outbreak. There are more than 113,000 confirmed cases globally. At least 3,900 people have died. Nikki Batiste kicks off our coronavirus coverage with the very latest from Wall Street.
The markets were sent downward today by a global oil price war and concerns over the coronavirus. Another massive stock drop that's stoking fears of a recession. The closing bell ended a bloodbath on Wall Street. Down nearly 8%, the worst finish in over a decade left traders almost speechless.
I think people are scared. They're looking at their 401ks. It's clearly markets in turmoil. You know, it's hard to know what to say.
In a rare move, trading was halted this morning after the first 4 minutes. An oil price war between the Saudis and the Russians and the spreading coronavirus sent the market down over 2,000 points and oil prices to their biggest drop in nearly 30 years. With schools and institutions closing their doors, large events canceled, and nervous Americans scrapping their travel plans. Today's historic drop is likely to take a deeper toll on the consumer.
They're going to read that the Dow Jones Industrial was down thousands of points, and that in and of itself can have a real impact on a person's psyche, may even impact how they think about spending in the future.
President Trump blamed others for the market drop, but with recession fears increasing, the administration is considering tax cuts for individuals and industries most affected, including airlines and cruise ship companies.
In another sign of how concerned the administration is about the economy, the White House called an emergency meeting with Wall Street executives for this Wednesday. Lana?
Thank you, Nikki. For more on the markets, let's bring in David Ragland. He's the CEO of IRC Wealth and a certified financial planner. David, just a few weeks ago, market analysts predicted that the U.S. might dodge the worst of this economic impact. Were they wrong?
I don't think that they were wrong. I think that what we have is a lot of fear and a lot of panic going on right now, temporarily. I think that we got one curveball last week from the coronavirus, and I think this week we've got the curveball from the oil dispute that we have going on today. And so by looking at those two, you have fear coming through the market from the overall side, but the underlying economy looks still pretty healthy. You've got very good numbers from last week that I think a lot of people are not considering for the long term. They say, hey, that's in the past. But you've got very low interest rates, number one. You have very strong employment, number two. And number three is that we're all starting to do the same thing. We all have our hand sanitizers at the ready. And I think as we continue to get accustomed to the changes in our daily lives, we will start to see the economy shine back through.
So, David, you then think that the Treasury Secretary, Steve Mnuchin, just moments ago when he said that that the economy will, in fact, be in a good shape a year from now, you're confident about that?
Yeah, I feel very comfortable. I mean, when you look back, when we had SARS, the market went down by 20%. And here we're down 19% from the top. Obviously, a bear market is when we go down 20% or more.
Right, we're right there.
Bear markets are typically, though, two things. They're both price and time. And a lot of times we see in these violent corrections that we have a very violent move down, but depending upon how long we stay down. And so for the average investor, if you have a long-term plan in place, what should you do? Well, if you're long-term, you should continue with your plan. You should continue to contribute to your 401k. And you should understand that over time, historically, the market has gone up. And it's taken these bumps, which are big bumps, and they've absorbed it. The economy absorbs it. People absorb it. And we move forward. Becoming wealthy is simple. It's just not easy. It's simple because you have to save a little bit every year. You have to get out of debt over time. You have to invest a little bit every year. The hard part is the emotional piece.
Well, and you also have to time those markets right. So you brought up bear markets, David. I want to know, do you think we're going to head into that territory? Or, as you were saying, with time, an average bear market lasts a year, if not longer. Do you think we're just not going to make it there, that these fears will be set aside once the coronavirus, if the president is correct, starts to peter off?
Yeah, I think that you could easily tomorrow go down 2 or 3 or 4 more percent. That's an easy move for the market. In today's society, we have very, very violent moves. We have a lot less liquidity in the market. So another 2 or 3% could be easy. However, the time piece, that year, 2 years, when we look at a long-term bear market, because you have a very healthy underlying economy, I think we're going to look back on this as more of a correction, more of an opportunity to get back into the market. Now, it will be painful. You don't make your money in the bull market. You make your money in market downturns like this. Be greedy when everyone else is fearful. Be fearful when everyone else is greedy, according to the most famous investor, Warren Buffett. So if you are fearful right now, that's the challenge. How do I become wealthy? You become wealthy over time, and you become wealthy by managing your emotions during difficult times like we are in right now.
So, David, what I'm hearing from you, your advice to people concerned about their 401ks is buy.
I would say you're at a long-term table. You're at a 5-course dinner. And when you look at that, nibble along the way. You never have to jump all the way in. You never have to jump all the way out. You make money over time. You don't make money by timing the market.
David Ragland, thank you.
Thank you. Great to be here.
A cruise ship finally docked in California Monday after being held at sea over coronavirus fears. The Grand Princess was kept off the coast for 4 days after a previous passenger died from the illness. At least 21 cases have since been confirmed on board. Carter Evans reports on the precautions being taken next.
Tonight, more than 2,400 passengers who've been isolated in their rooms for 4 days are beginning to disembark from the Grand Princess.
Look at that, they got security out.
Over the next few days, they'll be transferred to military bases in California, Texas, and Georgia, where they'll be quarantined. International passengers will take charter flights to their home countries. As for the more than 1,100 crew members, so far at least 19 are infected, and all will be quarantined on the ship.
They've got a hell of a logistic problem.
We spoke to Wayne in June Holland as the ship docked in Oakland.
Most buses don't hold more than 60 people. Right. There's 2,500 people that they're going to move off the ship.
Their daughter, who's also on the cruise, is worried.
Nobody wants to see your family or anybody in any kind of dangers. Imagining that my parents were exposed and, they're in that class that is at higher risk.
The virus is making its way across the country in 36 states and Washington, D.C. That's where a top clergy member at Christ Church, Georgetown, tested positive for COVID-19, exposing hundreds. And concern is increasing in New York City tonight, with the chairman of the largest public transit authority in the nation telling New Yorkers,
if you can get around without riding the subway, do it.
This as the head of the Port Authority of New York and New Jersey, Rick Cotton, confirmed he has the virus.
He immediately went home and isolated himself, which is exactly what everyone should do, and he's working from home.
Large universities, including Columbia and Hofstra in New York and Stanford in California, suspended classes over concerns of exposure. And at this nursing home in Washington state, linked to at least 19 deaths so far, 6 more residents and 70 staff members are now showing symptoms. Passengers on the Grand Princess behind me will be screened before they leave the ship. The focus initially will be on people who require immediate medical attention. Now, anyone who's coughing or has a fever, they're going to have to wear a surgical mask and use a separate gangway from the other passengers. The goal is to have everyone off the ship and in quarantine within the next 3 days. Lana?
Thank you, Carter. Now I want to bring in Dr. Jeanette Neshwat, who joins me. She is a board-certified medical doctor of family and emergency medicine. So, Dr. Jeanette, as somebody who works in a hospital, what additional precautions are you and members of the hospital staff taking?
Sure. So, Lana, first and foremost, it's so important that we protect ourselves so that we not only protect ourselves, but we don't spread viruses to other people, to the patients. So, from head to toe, we wear a mask, goggles, gowns, gloves, and we do that with every patient that comes in, just to make sure that we are minimizing the potential spread of virus. So that's most important, in addition to the basics of everyone keeping their hands washed and clean regularly, and not just after you leave the restroom. And the studies show that 30% of people do not wash their hands. So we can significantly reduce the risk of transmission of infection, viral infections, bacterial infections, simply by washing your hands.
Are you seeing behavioral changes that you think will last beyond the coronavirus?
That's a great question. I hope so. We're seeing, disinfectants, Purell, hand sanitizers, more soap stations, hand washing stations, people washing and disinfecting countertops, cell phones, remote controls. I certainly hope so, because not only will it help protect against spread of virus, but other diseases, especially those where we get what we call superbugs, where we don't have the antibiotics to treat certain infections or antifungals and that sort of thing.
You mentioned our cell phones, and actually I believe that the CDC recommends that you clean your cell phone once a day. Is that necessary, or was it maybe it's once a week? How often do you actually clean your own phone?
As much as I possibly can, because especially being in the hospitals are mediums for, bacteria and germs. So any time I have the opportunity, I will wipe it down with a disinfectant. Of course, I'll use gloves while I wipe it down, and then I'll wash my hands afterwards, especially if you put your phone face down. around, and then you hold it up to your face. You're transmitting germs back and forth. And that's one of the other things we say not to do. Don't touch your face, your eyes, and your nose. So you're bringing up a contaminated object to your faces, which can make you more prone to picking up virus or bacterial infections.
Now, President Trump has been accused of downplaying the coronavirus. He's correctly said, though, that thousands of people die from the flu each year. But what makes the coronavirus so much more concerning to medical professionals?
Well, first of all, it's new, Lana. It's this novel virus, a new disease. It's spreading in a naive population, meaning we don't have immunity to it, and anyone is susceptible to it. So that's the concern. It's creating a level of anxiety and panic, but we shouldn't panic. We shouldn't, be fearful. What we should do is take precautions, be vigilant, and stay up to date with the latest information so that you can protect yourself. For example, no, not to travel, to go on a cruise ship. No, not to travel to an area where there's a known outbreak. For example, Italy, huge outbreak with many deaths. So knowing this information can help you, arm you with the tools to keep yourself healthy, to keep your neighbor healthy, and your family healthy.
Well, we heard Dr. Fauci say that if you are healthy, a lot of those types of activities are otherwise fine. But if you are in one of those at-risk groups, if you have an underlying medical condition or you're in the senior citizen population, that you should be concerned.
Absolutely.
At the White House press conference, we heard Vice President Pence say that he didn't know if President Trump had, in fact, been tested for the coronavirus. And the backstory for our viewers is that two members of Congress who spent time in the president's car and shaking the president's hand, in addition to being on Air Force One, they're now in self-quarantine after being in contact with a person who has, in fact, tested positive for the coronavirus. So I'm wondering, in your medical opinion, does the president fit the profile of a person who should be tested for the virus?
That's an excellent question. The risk of transmission from that one person that tested positive, I believe it was just a handshake, and then that person, was exposed to another person, and then the president came into contact with that person. The risk of transmission is extremely low. It's possible. Nothing is impossible. But the risk of transmission is extremely low. Right now, he would not meet the criteria for testing. You have to meet criteria, chest pain, shortness of breath, fever, body aches, malaise, those sorts of things. Now, the fact that he's the president, makes it a little bit more special. He probably will, out of abundance of precaution, privately, quietly get tested, and then maybe release that information to us. But the risk of transmission is extremely low and probably unlikely, even though anything is possible.
So let's talk about that risk of transmission. Remind our viewers, how long can somebody be infected with coronavirus before showing symptoms and be contagious to other people?
Sure. So you can potentially pass it to another person, be asymptomatic, without having symptoms. Asymptomatic meaning I can spread it to you and not have any symptoms. You can be a carrier, and the incubation period can last up to 14 days. That's just an estimate, approximate. We don't know the exact number. We don't know the exact days, but 14 days is a good amount of time. Usually for most viruses, a few days, you'll start to see symptoms, you'll start to feel symptoms. Most of the people that do have symptoms, though, Lana, are extremely mild, and the majority of people that contract the coronavirus will not require any medical intervention.
Dr. Jeanette Nashua, thank you so much for joining us.
Thank you, Lana.
President Trump downplayed the threat of the coronavirus on Monday, and we're also learning more about a potential exposure in the White House. This, as I mentioned, as some members of Congress self-quarantine. Paula Reed has the latest on the new questions the Trump administration is facing about the outbreak.
As he returned to the White House this afternoon, President Trump waved but refused to take questions. Though on Twitter, he continues to downplay the global epidemic, accusing Democrats and the media of trying to inflame the coronavirus situation. That directly contradicts members of his own administration.
Make no mistake, this is a very serious health problem.
The president also publicly defying government recommendations on hygiene.
It sounds simplistic, but it's true. Washing of hands.
And now CBS News has learned the president may have been exposed to the virus himself. At least 4 members of Congress have decided to self-quarantine after coming into contact with a person who tested positive for COVID-19. The contact occurred at a conservative convention in Washington less than 2 weeks ago. One, Georgia's Doug Collins, can be seen here with the president on Friday. And Florida's Matt Gaetz traveled on Air Force One with the president just today and announced his self-quarantine roughly an hour after landing. Gaetz made fun of the coronavirus response last week when he wore a biohazard mask on the House floor. Matt Schlapp, who oversaw the conservative convention, is also in self-quarantine. His wife, Mercedes, was expected to be part of a Women for Trump bus tour with the president's daughter-in-law. The tour has now been delayed, even as the president has yet to curtail his own campaign travel.
And Paula Reed joins me now from the White House. Paula, we just saw the president and members of the coronavirus task force. They say that they're going to meet with members of Congress and they're going to weigh further economic measures. What else came from this briefing?
The biggest surprise, of course, was an appearance by President Trump, who was not expected at this briefing, though he did not take any questions. He left that to the vice president and others. It's pretty significant that the president has not taken any questions from reporters, despite having an opportunity in the briefing room. We greeted him as he returned to the White House, and he was with the traveling press pool earlier in Florida. So on a day when the coronavirus is spreading, markets are tumbling, the prices in oil are going down, it's surprising that the president did not take the opportunity to answer any questions to help calm Americans. But it's significant here that the president is going to head to the Hill tomorrow with his economic team to seek a possible payroll tax cut. Because up until now, the president and his top economic advisor, Larry Kudlow, they have expressed some skepticism about any kind of broad intervention or broad economic relief. Last week, Larry Kudlow told us that if they did anything, it would be narrowly tailored, and he wasn't even willing to say what specifically they'd do. And Lana, for the past, almost the past year, this White House has been trying to figure out what other kind of tax relief they could offer, but they didn't actually think that they could get anything done with a payroll tax cut. They even contemplated for about a minute possibly doing a capital gains tax cut because they thought they could do that from the White House without any support from Congress. So it'll be very interesting to see how this goes tomorrow when they head to the Hill to talk to Republicans, and then when they try to get support from Democrats to try to get this through.
Yeah, and Paula, you mentioned that it was odd that the president didn't take questions from reporters. And I have to say that I thought it was a little odd that he left before the end of the briefing. Were you given any indication of why the president had to leave or why he left?
So this is just a sneaky trick that administration officials, it's not exclusive to the Trump administration. Folks in the Obama administration used to do this too. They will come out, they will take advantage of the attention of the cameras, they will say their piece, and then they will get out of there before reporters start yelling questions. But as you heard in the briefing, there was an uproar. People started yelling questions. They wanted answers from the president. But I've seen other officials, in addition to the president, try to do this. It's something that we do not appreciate, because the understanding is if you come to the briefing room, we will give you the publicity, the attention, amplify your message, but in exchange, we expect that you'll answer at least some of our questions.
Paula, I'm also wondering, what's the Trump administration doing to try and prevent the virus from spreading within the White House?
Well, it's interesting. The White House is telling foreign officials not to visit, instead trying to do their meetings over the phone or video conference. But President Trump has some events later in this week. He is headed to Las Vegas for a fundraiser and a speaking engagement, and we're told that he still wants to carry on with that trip.
And Health and Human Services Secretary Alex Azar was appointed by President Trump to lead a coronavirus task force. Paula, you tried to ask him some questions about coronavirus testing on Monday. What happened?
I did. We were all waiting for him. Traditionally, when officials come down here to these tents to do cable news appearances, the understanding is that if you speak to that one or two outlets, usually CNN or Fox, that you will speak to all the other outlets too. You stop at a microphone stand. There are agreements about where they stand, agreements about how far we can chase them. And he did not stop to talk to us. We were pretty upset because this is a significant day. He talked to Fox and Fox Business for extended interviews, but then made us wait until after the markets closed to answer a lot of pressing questions that people had. Specifically, we were interested in where these tests were. Apparently, they shipped 1 million tests. Well, are they in transit? Had they arrived? These were very significant questions that we wanted answers to, so we did not let him off the hook. He came, he gave comments, and ran away way before he asked questions, but I chased him.
Good for you, Paula. Thanks so much. Coming up after the break, Italy expands its quarantine measures. The whole country is now on lockdown. Plus, Saudi Arabia detained some senior members of the royal family. What we know about an alleged coup. And later in the hour, Joe Biden picks up some key endorsements. The former candidate's backing him now, just a day out from some crucial voting contest. This is CBSN, CBS News, always on.
You can watch CBSN 24/7.
We've got an amazing story to share with you.
Let's talk about the latest developments. There's so many levels to this.
We have a CBS News exclusive.
Fires in California. What happens next and how does it all play out?
We are on a mission with NASA.
I understand you have some breaking news. It's not over yet is the bottom line.
This is a massive operation.
It's quite an adventure here at CBSN.
It's been a day. Wow. That's not normal.
Telling the whole story means going where the story is.
How did you get rescued?
Listening when people are hurting. Sorry. Getting to the heart of what matters.
Wow.
That's who Nora is. That's what Nora does. The CBS Evening News with Nora O'Donnell from Washington, D.C.
Good morning to you and welcome to CBS This Morning.
Understanding the world.
We're going to begin with breaking news.
Begins with the right questions.
Have police discovered a motive? Does the president have a red line here?
What can voters expect to see today?
Join Gayle King, Anthony Mason, and Tony DeCopel on CBS This Morning.
We know a little more this morning. This is a major development.
This is a very serious situation.
More news every morning on the show everyone is talking about.
We have much more news ahead for you.
CBS This Morning.
Good morning to you and welcome to CBS This Morning.
Understanding the world.
We're going to begin with breaking news.
Begins with the right questions.
Have police discovered a motive? Does the president have a red line here?
What can voters expect to see today?
Join Gayle King, Anthony Mason, and Tony DeCopel on CBS This Morning.
We know a little more this morning. This is a major development.
This is a very serious situation.
More news every morning on the show everyone is talking about.
We have much more news ahead for you.
CBS This Morning.
Italy's prime minister announced a nationwide lockdown Monday. The country is struggling to contain the largest outbreak of the coronavirus outside of China. Charlie D'Agata reports from Rome.
Dramatic new developments at the sharp end of what's become the worst outbreak outside of China. Prime Minister Giuseppe Conte announcing tonight severe restrictions on the entire nation of around 60 million people. From tomorrow morning, all sporting events are off, including soccer. The general public should only go to work and work from home if possible. Public gatherings are out of the question. Here's why. Government figures tonight continue to soar. More than 9,100 cases, 463 fatalities. Coronavirus contamination is growing in number and spreading in territory. Even before the dramatic move tonight, the World Health Organization had applauded Italy's extreme step forward.
We're encouraged that Italy is taking aggressive measures to contain its epidemic.
Aggressive measures that look like this. New video allegedly showing an intensive care unit inside Italy's red zone. Over the weekend, soccer matches were played to empty stadiums, ski resorts shut down, even Pope Francis appearing on wide screens instead of the papal apartment, anything to keep the crowds down.
The Prime Minister said, we're running out of time. Americans, they can travel back home. That's not going to be an issue. Italians are being told, try not to travel. In fact, try to stay home unless completely necessary. Lana?
Thank you, Charlie. The Saudi Crown Prince has detained some of the most high-profile members of his own royal family. Mohammed bin Salman made the arrests last week. They included his uncle, Prince Ahmed bin Abdulaziz, and his cousin, Prince Mohammed bin Nayef. Both are reportedly accused of treason and plotting an alleged coup. The arrests were first reported by the Wall Street Journal The move is considered a consolidation of power for the Crown Prince. Justin Scheck is one of the reporters of that article, and he's also co-author of Blood and Oil, out later this year. He joins me now on set. Justin, for people who maybe aren't following all the saga of the Saudi royal family and the number of times that power has been consolidated behind MBS, can you tell us how significant is this move?
Well, we're still trying to figure that out ourselves. To understand what's happened is you've got the king, Salman, but the sort of day-to-day ruler of the kingdom is his son, Mohammed bin Salman. And prior,
MBS, as a lot of people know him.
And so prior to MBS becoming crown prince, his predecessor was a cousin, Mohammed bin Naif, or MBN. And he was sort of cast aside in 2017 and has been very restricted in his movements. And the latest development is that MBN, the prior crown prince, and the prince's brother, Ahmed,
the king's brother.
That's right, the king's brother, Ahmed, the prince's uncle, were brought in, detained, questioned, and initially accused of some sort of coup or treason. The government seems to have sort of walked that back since then, and it looks like they're framing it now as sort of a warning like, you watch out, you better support us, or else there could be consequences.
So the punishment, the penalty for a plotted coup could be execution or lifetime in prison, and it sounds like maybe they're backing off on that now?
It seems like they're backing off and now not officially accusing them of a crime. It seemed like more of a show of force and perhaps a way of saying, if you were thinking about doing anything bad, we're onto you.
Right. And MBS has been accused of the brutal murder, or ordering the brutal murder, of Washington Post columnist Jamal Khashoggi. He's also jailed dissidents after initially having a very strong relationship with the Western world. That has soured. Tell us how this might be an extension of what we've seen from MBS.
So it's a complicated thing where I think he's had a pretty productive relationship with the White House. There was the incident where a bunch of guys who work for him killed this commentator for the Washington Post, Jamal Khashoggi, and the relationship with the White House seems to have continued. Now you've got this situation where there have been ongoing crackdowns against dissidents, which a lot of human rights advocates have criticized, but the U.S. seems to have kept pretty good relations. The complicating factor here is MBN was probably the closest contact for the State Department and the CIA in Saudi Arabia for almost 20 years. He was the anti-terror chief for the country. He was a close collaborator with the U.S. So now you have a situation where
the person who was the #1 contact for the United States in terms of intelligence and the State Department is now out of the room where it happens.
Exactly, and he has a lot of allies or former allies or friends in the U.S. intelligence and security and State Department establishments. And so I think it's an awkward situation for these career government people because, you know, an ally of the White House, MBS, is doing this crackdown. So it's sort of a confusing situation. It's hard to tell what kind of reaction there will be. And so far, the U.S. politicians have been pretty quiet about it.
Yeah, I'm wondering also if the backing off that you're describing from accusing them formally of a coup, if that might reflect any behind-the-scenes political pressure from the United States?
You know, I don't really know. It seems like what happened, if you follow the timeline, is that on Friday there were these arrests or detentions, we call them, and then over the weekend, sort of surprisingly, Saudi Arabia announced they'd be cutting the price of oil in this sort of price war with Russia, an attempt to kind of undermine the U.S. oil production. And it seems like there was a lot of speculation that it may have been about the king's health, but in hindsight, it seems like MBS may have been trying to tamp down any dissent before engaging in a really potentially destabilizing oil price war.
So the oil price, the oil price war, or is it fair to call it a war yet? I'm not sure.
I don't know. Really know yet. I mean, Russia wanted to keep.
Right.
Russia didn't want to do this. Saudi Arabia is trying to pressure everyone. Conflict is probably
all right.
better.
So this oil conflict that has been motivating the markets here in the United States and impacting American consumers actually is all tied back potentially to this move by MBS to try and consolidate his power.
Speculatively, it's entirely possible. We're still trying to figure out what's going on, as we so often are with Saudi Arabia.
And that's what I was going to ask you next. How difficult is it to actually learn what's going on there as somebody who follows it so closely?
Well, it's a complicating thing because they can be very. There's often not a lot of communication coming out of the kingdom, but it's also a place where when people learn a little tidbit of information, it tends to go into this echo chamber. So we get like this kind of fire hose of stuff, but a lot of it isn't accurate. So, I mean, it's hard to figure out what's rumor, what's speculation, what's actual information.
Does it make it hard to see what the reaction is really on the ground from the Saudi public?
Yeah, I mean, that's extremely hard because, as you know, we and others have written about, there's a lot of pressure to not criticize the royal family. And then you have Saudi dissidents outside the country who only criticize the royal family. So to figure out what people actually are feeling can be hard. And we have colleagues who are there. And, you know, it's difficult to know broadly what people think. There's not a lot of opinion polling in Saudi Arabia.
Justin Sheck, thank you.
Thanks.
Coming up after the break, 6 states head to the polls on Tuesday, including Michigan, where more than 100 delegates are at stake. We have a preview. You're streaming CBSN.
You can watch CBSN 24/7.
We've got an amazing story to share with you.
Let's talk about the latest developments. There's so many levels to this.
We have a CBS News exclusive.
Fires in California.
What happens next, and how does it all play out?
We are on a mission with NASA.
I understand you have some breaking news. It's not over yet, is the bottom line.
This is a massive operation.
It's quite an adventure here at CBSN.
It's been a day.
Wow. That's not normal.
Telling the whole story means going where the story is.
How did you get rescued?
Listening when people are hurting. Sorry. Getting to the heart of what matters.
Wow.
That's who Nora is. That's what Nora does. The CBS Evening News with Nora O'Donnell from Washington, D.C.
Good morning to you and welcome to CBS This Morning.
Understanding the world
We're going to begin with breaking news.
begins with the right questions.
Have police discovered a motive? Does the president have a red line here?
What can voters expect to see today?
Join Gayle King, Anthony Mason, and Tony DeCopel on CBS This Morning.
We know a little more this morning. This is a major development.
This is a very serious situation.
More news every morning on the show everyone is talking about.
We have much more news ahead for you.
CBS This Morning.
A new poll shows Joe Biden widening his lead in a key battleground state. A Monmouth University poll released Monday shows that the former vice president now has a 15-point lead over Senator Bernie Sanders in Michigan. Sanders narrowly won that state in 2016. Voters there and in 5 other states will head to the polls Tuesday. Natalie Brand spoke to voters in Michigan ahead of Tuesday's crucial contest.
Thank you.
Senator Bernie Sanders hoping to repeat his success in Michigan 4 years ago.
For our next president, Bernie Sanders.
Held 4 rallies across the state in the final days before Tuesday's vote.
Michigan could be a make or break moment for Sanders. Do you see it that way?
Sure, absolutely. Yep. And I'm hoping that I can make a difference.
Joanne Keeling also backed Sanders in 2016 when he narrowly defeated Hillary Clinton in Michigan's primary in what was considered a major political upset.
I was really sad when he didn't make it, and I'm glad he ran again.
It was time for us to take it back.
But it's former Vice President Joe Biden who enters the next round of contests as the frontrunner and leading in a new Monmouth University poll. To take the temperature of Michigan voters, we headed to Sterling Heights in the heart of Macomb County, known as a key election bellwether.
You have blue-collar workers, you've got small business owners, you've got really every type of voter.
Including coveted crossover voters. Sterling Heights Mayor Michael Taylor is one of them. He voted for President Trump in 2016, but this year he'll be voting in a Democratic presidential primary for the first time.
Who are you voting for?
Joe Biden. He's much more appealing to moderates like myself. He's more appealing to people who maybe are Republicans, generally vote for Republicans, but can't take President Trump anymore.
I want change. Manal Dababna also voted for President Trump in 2016. She's now backing Sanders.
I believe that insurance should be for all.
While I like Bernie's ideas, health care for all,
free college. I'm just not sure that's practical at this point.
While voters here weigh their choices, the results could give a revealing look at what's ahead.
Winning in Michigan means you've made connections with real people about very important issues.
Tuesday's primary offers the first taste of how voters feel in this critical battleground state. Natalie Brand, CBS News, Sterling Heights, Michigan.
So let's bring in Antoine Seawright. He's a CBS News political contributor and a Democratic strategist. And he's been saying from the beginning, don't count out Uncle Joe.
And South Carolina.
Right.
Be very clear.
So, Antoine, as we mentioned, Biden leads now in Michigan. But remember, in 2016, it was such a big deal when the polls showed that Hillary Clinton was ahead of Bernie Sanders, and yet Bernie Sanders narrowly won that primary. Could the polls be wrong again?
I'm always consistent when it comes to polls. They are a snapshot of the time, and the devil is often in the details. However, in this scenario, I think the Joe-mentum is flowing throughout this primary process. And make no mistake, tomorrow night's contest, not just in Michigan, but for the rest of the contest that will happen tomorrow night, could mean thrive or survive. It could mean thrive for Joe Biden, setting him up for the oh-so-important Florida primary process and other contests going forward. And it could mean survive for Bernie Sanders, who arguably has taken a step backward, considering what happened on last Tuesday night in the consequential Super Tuesday Phase 1 primary process. So tomorrow night will be very telling. What I'm looking for, particularly in Michigan, is the margin of victory by either one of the two who will win, but the type of coalition that it took to win in Michigan. Because as you know, Michigan will be a battleground state going into the general election. And so if enthusiasm is high, voter participation is high, white and black working class voters show up in a real way, that could be an alley-oop for what's to come in the general election.
I want to ask you about that because Biden won a lot of the states that Biden has won so far are states that are not likely to go blue in the general election. Sanders has been winning a lot of those. So if you were advising Sanders in Michigan, given its importance as a battleground state in the general election, what would you be telling him?
I would tell the senator from Vermont to focus on what you know. Go to where your bread is buttered. He knows there are certain segments of the Michigan voting Democratic population that will be strongly for him. He also knows where his weak points are. In a primary election, you have to focus on home base first. You turn out the home base. That's why Joe Biden has been very successful. He knows African-American voters are his strong point. They are the nerve center to his coalition. Therefore, he's been focused on that. And as a result of him focusing on that particular constituency, he's been successful to this point.
So for Sanders, that would be men, that would be young people.
And that would be white working class voters, particularly in a place where he won in 2016, where people did not expect him to win in 2016. But
he confessed that he has not been successful in turning out new voters.
Well, that's when you really have to crank up the energy. You have to put out an extra effort to drive home your message and remind people of what you will bring to the table as a candidate. And what people are looking for in this entire primary process, one is a candidate who can defeat Donald Trump, but two, someone who can speak to the hearts and minds of their issues. There are people sitting here, and while we sit here on this set, figuring out how they're going to pay for prescription drugs, how they're going to pay the light bill, whether they can afford to put gas in the car. Those issues hit home, particularly for places in this country where Donald Trump promised them one thing and it's turned out to be another.
Well, let's talk also about some of these endorsements. Biden has been stacking them up. We just heard Kamala Harris, Cory Booker, two senators who were previously competitors of the vice president's, throwing their support behind Biden. How important are these for tomorrow's contest and also for the general election?
These are not just endorsements. These are megawatt endorsements, considering we're starting to see this process collapse or compress to be a battle between arguably the socialist wing of the party and the progressive wing of the party. And we're starting to see that play out in these primary contests, and you cannot turn down the volume of that, what that means for the entire ticket going forward. At the end of the day, when we get a nominee, they have two jobs. One,